I am Dr. Richard Sebidwani from South Sudan. I work with VSF Swiss, Veterinarians Sans Frontiers Swiss, based in South Sudan as a veterinary officer. And I'm also a student in Cavendish University pursuing a Master of Public Health with focus on zoonosis and One Health. I'm happy to be part of the 9th cohort of Policy Advocacy on Genetics and Genomics course being organized by Pan-African GPS Education and Research Initiative. I'm part of Group 4, Team H, which is negative. Our topic is, should there be restriction on creating genetically modified animals for medical research in Africa, or should such research proceed to advance the healthcare innovation? I'm with the view of that such research should proceed to advance the healthcare innovation in Africa. Introduction part. Here we would like to examine the critical role of genetically modified animals in addressing Africa's unique healthcare challenges, and at the same time building the scientific capacity and reducing the dependence on imported medical solutions. We explore also the ethical framework necessary to advance this research responsibly while positioning Africa as a leader in biomedical innovations. Africa faces an extraordinary health challenges, including endemic infectious diseases, limited health infrastructure, critically lack of locally driven medical innovations, while the rest of the world advances in biotechnology, while Africa risks being left behind. Creating genetically modified animals for genetic research is necessary to step forward advancing the healthcare innovation in Africa and should be encouraged under responsible regulation. This approach recognizes both the unique health challenges facing the continent and the opportunity to build indigenous scientific capacity through cutting-edge research method. An opening statement, embracing modern scientific tools. With the growing burden of diseases affecting millions of Africans daily, the continent must embrace the modern scientific tools like genetic modification in animals to drive the homegrown solutions to our Africa unique health problems. By participating in cutting edge research, Africa can improve public health outcomes for millions of its population, reduce the dependency on foreign aid or solutions from abroad, building the sustainable scientific capacity on the continent, and establish leadership in global health innovation. Our constructive arguments for GMA animals in the research in Africa. One is addressing the Africa unique health challenges. Genetically modified animals can be engineered to model the diseases such as malaria, sickle cell anemia, HIV and AIDS, and among others conditions that disproportionately affect African population. And this will enable development of treatments, therapies, vaccines tailored to local genetic profiles and environmental factors. 2. Boosting scientific capacity. Engaging in advanced research beyond local expertise attracts funding, creates specialized infrastructure, and this encourages the training and retention of African scientists who might otherwise pursue careers abroad. Also, 3. Reducing the dependence on imported solution. A homegrown solution is always encouraged, and this is many treatments that are developed abroad may not be accessible or suitable for African population or an African context or the environment, but locally genetically modified animals research allow Africa to develop and test its healthcare solutions, aligning it with the specific needs and economic realities on the ground. 4 is the ethical and regulated advancement. With proper oversight an ethical review board, genetically modified animals research can be conducted responsibly. International partners also can help to establish specific protocols that to ensure that safe and humane and culturally modified research practices. Provital opposition concern for one, weak animal welfare system, two, biosafety and environmental risk, three, cultural and social sensitivity, four, exploitation risk and foreign agendas. Our responses to this rebuttal from the opposing team, from the other team, is that when for weak animal welfare system, effort are continuously being made to improve animal welfare in Africa with strict regulations and technological advancement. For our case, like in South Sudan, there is already an animal welfare strategy being developed, a draft policy developed and on its way to the Council of Ministers and later to the Parliament and being passed and become a law. And I hope the other countries in Africa are also doing the same, improving the animal welfare. And this animal welfare improvement will ensure that humane treatment of genetically modified animals treated humanely, minimal suffering, incorporating the animal 5 freedoms and domains, and also adopting the 3 R's principle, which is replacement, reduction, and refinement, to minimize pain and distress. Biosafety and environmental risk, robust regulatory framework and scientific advancement are mitigating biosafety and environmental risk, with industries adopting sustainable practices. 3, cultural and societal sensitivity, engaging with the local communities via discussion about ethical implications of using genetically modified animals, public consultations, educational campaigns, open forums, and incorporating their values and their views, and at the same time ensuring that cultural appropriateness and societal benefit is incorporated, and also collaboration to ensure animal welfare and ethics in research align with the societal values and other ethical standards. Exploitation and risk of foreign agendas, transparency and accountability is always key, and an equitable partnership helps prevent exploitation and ensure ethical international collaboration. Closing statement: health equity through innovation. Creating genetically modified animals for research, for medical research, transcends being merely a scientific issue. It is actually fundamentally a matter of health equity and innovation for Africa. By developing the capacity in this field, Africa can, one, address the neglected diseases, the NTDs. This is by developing therapies or treatment for conditions that receive little attention from the global pharmaceutical companies, but it also devastates the African communities. 2, build scientific independence by establishing sovereign capability to respond to emerging health threats without waiting for external assistance or solutions from abroad. 3, creating economic opportunities. This is by generating intellectual property, biotechnology ventures, and high-skilled jobs within the African scientific ecosystem. The future of Africa healthcare depends on embracing rather than shying away from the scientific frontier. Call for action: a framework for responsible innovation. African nations should adopt responsible regulatory framework that enable them to, 1, harness the benefits of genetic science for public health, lead their own research agendas based on local priorities. 3, create healthcare breakthrough that serve their population. 4, participate as equal in global scientific discourse. We recommend the establishment of Pan-African Bioethics Commission to develop contextually appropriate guidelines for genetically modified animals research that can balance innovation with ethical consideration and cultural values. This is my reference, questions and answers. Thank you.